Hi everyone, Dr. Brooke Kolesiak of Legacy Physical Therapy. This week we've been seeing a lot of patients who are dealing with overactive bladder symptoms, or OAB for short. So this is actually an extremely common condition that over 33 million people in the United States are affected with. Symptoms of overactive bladder include urinary urgency, frequency, urge incontinence, and potentially just that overall feeling of, I just gotta go all the time. So unfortunately, many people think that this is just an inevitable part of aging, that as we get older, I'm just gonna have to know where all the bathrooms are and my bladder is gonna be in control. I'm here to tell you that's not the case. What's our catchphrase here? Common, not normal. So we don't need to just accept this. There are things we can do if you're dealing with overactive bladder symptoms to help you get back in control of your bladder. So first and foremost, how do we even know if you're dealing with overactive bladder? And there's actually a questionnaire that you can take to find out if you have overactive bladder. And so it's 8 questions. It's really simple. You're going to rate yourself on a score from 0 to 5, where 0 is you're not bothered at all by this, and 5 is you're bothered a great deal with it. So here are the 8 questions. Number 1, how bothered have you been with frequent urination during the daytime hours? Remember, rate it from 0 to 5. Number 2, how bothered have you been with an uncomfortable urge to urinate? Number 3, how bothered have you been with a sudden urge to urinate with little to no warning? Number 4, how bothered have you been by an accidental loss of a small amount of urine? Number 5, how bothered have you been with nighttime urination? Question 6, how bothered have you been with waking up at night because of your bladder? Question 7, how bothered have you been with an uncontrollable urge to urinate? And last but not least, question 8, how bothered have you been with a urine loss associated with a strong desire to urinate? So those are the 8 questions, and remember, rate them from 0 for not bothered at all the way over to 5 where you're extremely bothered by it. So tally that up. If you have a score of 8 or greater on the overactive bladder questionnaire, then you may be suffering with overactive bladder, and you should talk to your healthcare provider about it. I'm a pelvic physical therapist, and we work with people all the time who are dealing with overactive bladder symptoms. And the good news is that there are many effective treatments out there that actually don't involve you having to take medications or any risky surgeries. There are lots of natural options. So if what I just talked about resonates with you as like, man, I feel like this is me. My bladder is kind of in control of things and I'm dealing with overactive symptoms, then I want you to reach out. You can give us a call at 636-225-3649. Talk with one of us to learn more about how pelvic physical therapy can help you out. If you're not local, let us know. We'll try and pair you up with someone else in your area who can try and help you out. But I want you to know that symptoms of overactive bladder are common as we get older, but they are not something that we are doomed to suffer with. They are something you can do something about, and we want to make sure you get the help that you deserve. So there you go. That's today's live video, and I hope you find it helpful. Drop us a note in the comments as to what else you'd like us to come on and talk to you about so that we can keep giving you the knowledge to help you take control of your pelvic health. Again, have a great day, and I'll see you guys next time.